Good evening, everyone. Thank you for joining us today with Cien. We are in the process of going through our first virtual program for 2021. We have a little video that we want to show you first before we start our introductions. So why don't we go ahead and play that video now. Good evening, everyone. Thank you for joining us this evening. This is our first program with Cien for 2021, and we're happy to be joined by a very distinguished panel of Sonoma County leaders. The goal for tonight's program is to try to cover, I know we're covering a lot of ground, but we want to try to hit a reset button and try to be in a position where we take a look back in 2020 and figure out what happened there, and then try to figure out what we're trying to do in 2021 and what we can do from the government side, the healthcare side, and the economy side to get us to a new normal, whatever that may be. Before we get started, I wanted to let you all know that we are on Facebook Live and we are on Zoom. So if you're on Zoom and you have any questions that you want to ask the panel during the Q&A, please write out your questions in the Q&A or chat function of the Zoom, and we will pick them up and then we'll ask the panelists as we go along. If you're on Facebook Live, do the same during the Facebook Live thread, and we'll pick those up and do the same. I wanted to thank our premier partners, which in this case is the County Community Foundation of Sonoma County, Redwood Credit Union, Petaluma Health Center, the Press Democrat, the Luther Burbank Center for the Arts, and Kaiser Permanente. We also want to thank our platforms partners, which without their help, we could not make these programs happen. And that is the Federated Indians of Great and Rancheria, IOLERA, Career Technical Education Foundation, Rebuild North Bay Foundation, Healthcare Foundation of Northern Sonoma County, the Economic Development Board of Sonoma County, Comcast, PG&E, AT&T, the law firm of Perry Johnson, Anderson, Miller, and Moskowitz, the United Way of Wine Country, and the County of Sonoma. So thank you all for your sponsorship and helping us create a virtual table in which these discussions can take place. So, as I mentioned earlier, we have speakers from government, healthcare, and the local economy to come and say their pieces of what they see happening in 2021. And we'll start off with the introductions of our panelists. First, we have Supervisor Lynda Hopkins. She is in her second term representing the 5th District of Sonoma County. She's an attendee and graduate of Stanford University with a master's and BA degrees from that institution. Supervisor Hopkins is passionate advocate for climate policy. She is also the new chairperson for the County Board of Supervisors. And what we would like to hear from her once we get started is, where does she see the county's role in the development of the rollout of 2021? We also have Director Barbie Robinson. She was appointed by the Board of Supervisors in February of 2017 to be the Director of the Department of Health Services. She was previously its interim director. She has over 21 years of experience as a healthcare administrator with the federal government Center for Medicare and Medicaid Services. She is also a member of the State Bar of California, earned her master's in public policy from Georgetown University, Juris Doctorate from George Washington University School of Law, and her BA in political science, Spanish, and international sociology from Middlebury College. She heads the Department of Health Services, and we'll be hearing from her and her team, which also includes Dr. Sundari Mace, She was appointed by the Board of Supervisors to serve as the interim health officer for the County of Sonoma effective March 10th, 2020. Right in the thick of things, she was thrown into it, so thank you for your service. Dr. Mays is a graduate of University of California, Berkeley, medical degrees from UCSF. She is a county health officer and responsible for the protection and promotion of public health for the County of Sonoma. We also have joining us Dr. Urmila Shende, who is currently with the Sonoma County Department of Health as its vaccine chief. She has been working with the department in that capacity since March 2020, providing expertise in the COVID-19 response efforts. We also finally, last but not least, we have Director Shiva Person Whitley, who is the Executive Director of the Sonoma County Economic Development Board. And her role at the EDB is to help and support small businesses in Sonoma County. She has done so since May of 2019 during fires, pandemics, and everything that's going on. So we will hear from Supervisor Hopkins first on the government's local government, Sonoma County government side of where they see 2021 shaping up, and then we'll move down to public health and then to the economic side with Director Person Whitley. So Supervisor Hopkins, take it away.
Thank you so much, and thank you for setting the stage and for inviting me here this evening. You know, I think that many of us were disappointed by the way 2021 started out, right? 2021 started out too much like 2020. Still in the pandemic, still witnessing the disparate impacts on some of the most vulnerable members of our community. And of course, most alarmingly, the rise in white supremacist and nationalist violence that ultimately led to the storming of our Capitol, which I know just hit home for a lot of us, even though we were far away from that when it happened. And yet, you know, I actually feel like I can finally wish people a happy new year. After January 20th, I feel like I can breathe a little bit again. But it's actually not just the changing of the guard and the upholding of democracy in Washington, D.C. that gives me hope. It's actually the women that are in front of you on the sort of virtual stage with me today, because every single one of these people is fighting day and night. And I know definitely late into the night and in the early mornings, because we texted all hours of the day and night, really to fight for equity, really to fight for a more effective and fair response to how we handle the pandemic. And so I'm really excited to share tonight some of the initiatives that the county is undertaking, but I don't want to steal too much of the thunder because I know that they'll be presenting some of the more specific elements as well. You know, one of the biggest challenges is that we are working within a system that is inherently inequitable. You know, there's a lot of concerns about, honestly, the way the state has set up the framework. At the end of the day, it advantages people who have access to technology, who have time to go ahead and, you know, try to set up their appointments. And yet what we are doing at the county level is actually trying to fight against that tide. And it's not always easy and we don't always succeed, but damn it, we're going to try. And so we've been doing things like actually prioritizing our most vulnerable seniors and actually personally calling folks who are socioeconomically disadvantaged residents over the age of 75. That one-on-one contact, actually scheduling folks for vaccines, means that we are actually taking a very equity-centered approach. But it's not just the vaccines. I think vaccines are on everyone's mind, but we also have to acknowledge that we are in what is currently the worst of the pandemic. We have had the most fatalities this month in Sonoma County out of any of the months since the pandemic began. And so even while we're moving forward with the vaccines, there's still the other issue of equity, which is that we know that transmission has disproportionately impacted our Latinx community. We know that job loss has also disproportionately impacted our Latinx community. And so there's a huge need to not only fight as hard as we can for equitable vaccine distribution, but also to bolster the support systems to get us through these last few months of the pandemic. So to that end, the Board of Supervisors is continuing with our Emergency Food Assistance Program. We are also continuing to fund the Cura project, which came out of the Latinx Health Task Force and Working Group that was convened by Director Robinson specifically to address these disproportionate impacts. And so we are really trying to make sure that that community is taken care of, even as we also try to make sure that they have early access to vaccines as we move forward with that. I also want to mention, finally, I get to say thank you to the federal government, which is that we did have $14.7 million deposited in the county treasury specifically for emergency rental assistance. And I know that Director Robinson's team at the CDC is working hard also, again, to make sure that there is geographically equitable distribution for those funds. Additionally, I'm very excited that my colleagues on the Board of Supervisors have actually given staff direction and taken some preliminary steps to expand emergency paid sick leave. The federal protections unfortunately expired at the end of last year, and we are also going to be returning to take a vote on tenant protections, including a just cause eviction protection policy on February 9th. And then I also believe, because Director Robinson, I think, doesn't sleep, I feel like I keep referring to her, that she'll be returning to the Board of Supervisors this Tuesday, February 2nd, with a request for additional resources to bolster that vaccination campaign and strategy, and again, to really focus on equitable vaccine distribution. Finally, I know that we've got some influential members of our community listening in, and so I would just like to make a plea, which is that just because you can get the vaccine doesn't mean that you should. Unfortunately, what has been happening over the past few days in particular, that we have had some folks who get access to links that are supposed to be reserved for some of the most vulnerable members of our community. And so they've actually gone forward and secured appointments for themselves for vaccination that were intended to be used for high-risk populations. So we're kind of struggling in some ways to manage the equity within the community, because once that word gets out, it feels like everyone jumps on board, the system crashes, and then unfortunately those members of our community who are most vulnerable, their vaccines are taken up, right? Because there are only so many appointment slots, there are only so many vials. So my plea to the community is just to be patient and to please wait your turn. Line jumping is unfortunately becoming an increasing problem in Sonoma County, and that really just serves to exacerbate those socioeconomic and also racial disparities that we already see with respect to access. So we're hoping that the community will work with us, and I know it's frustrating. I know everyone wants the vaccine yesterday, but it's also really important to have patience. So thank you very much for the opportunity to speak today, and I can't wait to hear from the other panelists.
Well, thank you very much, Supervisor Hopkins, for giving us that great overview. And I'm certain that we'll have questions to come your way following up your comments. What we're going to do next is turn it over to our Department of Public Health folks, which is Director Robinson, Dr. Mays, and Dr. Shende, and Ms. Candela. And however you want to present at this point, the floor is yours.
Thank you, Mr. Pardo. Good evening, everyone. Barbie Robinson. It really is an honor to be here with you all. I know that the last time we were here, we were in the middle of what I termed a racial pandemic, given the impact of COVID on the Latinx community. And we were here to talk about all of the efforts that we put into place to try to address that. Those disparities. And so today, I think our goal is to provide you with an update on the work on where we are in responding to the pandemic, our strategies around vaccine coordination and administration within the county, and our eye on equity. We were remiss in introducing Dania Candela, who is the equity manager in the COVID unit section within the Department of Health. And she's been instrumental in helping us think through the strategies and centering equity in the work that we do. And so we're grateful to have her on board. It's a tall lift as her work is focused on the COVID response as well as our vaccine administration strategies. And so without further ado, I will turn it over to Dr. Mays, Dr. Shende, and Ms. Candela to talk about where we are. And so I don't know who's starting out, if that's you, Dr. Mace, or if it's Dr. Shende.
Great, thank you so much, Director Robinson, and thank you, Chairwoman Hopkins. We are going to do a presentation, and let me pull up my slides. Just a second while I share my screen. Just making sure this is the latest version of our slides. Just a second. Sorry. Yeah. Okay, good. Let me put this in presentation mode for us. Great. So thank you everybody for joining us tonight. It's my pleasure to present on COVID, and then Dr. Denia Candela will talk about health equity and strategies, and then we'll have Dr. Urmila Shende talk about vaccine strategies and administration. So I would like to go over the review of the COVID case data. As you know, very recently, we have come out of the state's stay-at-home order, and the governor has lifted that stay-at-home order. We do not have a local stay-at-home order at this time. So we're going right back into the blueprint for opening of the safer economy from the state. And our tier status is purple. And we're in purple because our unadjusted case rate is 42.2. Our adjusted case rate, because we are doing a lot of testing, is 34.3. And we would have to have an unadjusted case rate, or that is an adjusted case rate less than 7 new cases per 100,000 to go into the red tier. And right now, as you can see, our adjusted case rate is 34. Our testing positivity overall is 8.3%. And our testing positivity in that lowest HPI quartile, that's the lowest 25% of, in terms of socioeconomic status, is 13.3%. Both of those would need to be under 8% for us to get into the red tier. So we, along with pretty much all of the other counties in the state, are in the purple tier at this time. Our ICU bed capacity, which is something that we've discussed quite a bit over the past few months, is relatively good. Our percent of ICU beds that are available is actually 34.1%. And the percentage of ICU patients that are COVID-19 positive are 50%. So you can see in the green is Sonoma County's ICU bed availability, and in the purple is the overall Abajo region. So we are doing okay from this perspective here in Sonoma County. As you know, as I just mentioned, we exited the regional stay-at-home order on January 25th. That means that we're in the purple tier, and the restaurants and fitness centers are allowed to operate outdoors. Personal care services like hair and nail salons can reopen with modifications. And many of our non-essential indoor businesses remain closed. You can go to the state website to see what is open in the purple tier. We still are very worried about this case rate. We are now, as I showed you, unadjusted, about 42 new cases per 100,000 residents per day. And that is, as you can see, much, much higher than what we were seeing in fall and through November. And if you look at the cases by race and ethnicity, the majority of our cases have occurred and been occurring since the beginning of the pandemic in the Latinx population. 65% of our cases have occurred in that population. We also have large numbers of cases observed among white individuals and cases for whom race and ethnicity is unknown. These unknown groups probably will end up being classified as Latinx if we had the full data. So this, again, is an underestimate of the cases in the Latinx population. And the case trends and peaks have been observed throughout all of the races and ethnicities. If you look specifically at the Latinx cases, definitely occurring in a younger group. And that is probably because our essential workforce is largely coming from the Latinx population, and they're a younger age. And the unknown race and ethnicity cases show a slightly denser concentration of cases also in the younger age group, which again contributes to the theory that probably a good proportion of these people also fit in the Latinx group. And if you look at the white population, we see a trend towards older individuals with cases, probably because we've had cases in the residential care facilities for elderly and the skilled nursing facilities that would skew this towards more of a white population. And our the statewide case peak was in week 51 to 52. Our peak was in week 2. The new high case count is in week 2 as well. Week 2 of this year, that is. So you can see that we started in week 28 of 2020, and this is weeks 1, 2, 3, and 4 in 2021. So we had the newest high case count in week 2. Hospitalizations also increased to a new high at the end of the year in week 50, and they continue to be high, but luckily it looks like those hospitalizations are coming down now, maybe as a result of the stay-at-home order, maybe as a result of this, the natural course of what we're seeing. Statewide deaths continue to be high throughout January, and Sonoma County deaths reached a new high in week 1 of 2021. That's why we consider this to be really a dark place in the pandemic still. If you look at our deaths, the deaths have ranged in age from 36 to 109 years. 62% of our mortalities occurred in people 75 and over, which again is the one reason for the age-based priority for vaccination that Dr. Shende is going to get into here in a few minutes. And close to 60% of the deaths have been amongst those people who are residents of skilled nursing facilities and the residential care facilities for the elderly, which is why we're really focusing on jumping in and doing vaccinations in this group, because we feel that the federal system of vaccination is a little bit on the slow side. We want to get to these people as soon as possible. If you take a look at hospitalizations and deaths by race and ethnicity, you can see that in the Latinx population, they represent about 1/3, a little over 1/3 of our hospitalizations, and a little over 1/4 of our deaths. However, they represent 65% of the cases. If you look at the white non-Hispanic population, they're making up about 1/3 of the hospitalizations, but close to 60% of the deaths, even though they're making up about a little over a quarter of the population. And this probably is reflected by the fact that we have a higher proportion of people who self-describe as white non-Hispanic who are in the residential care facilities and in the skilled nursing facilities where we've seen the worst outcomes. And because even though the Latinx community makes up 65% of all cases, these cases are occurring amongst younger people who are not having the worst outcomes of morbidity and mortality. And you can see the numbers are much smaller in other races and ethnicities, simply because in our county, these are the predominant races and ethnicities. If you look at the source of infection, we know all along the pandemic that gatherings have really contributed to COVID. And we know that we've linked at least 131 cases to Christmas and New Year's gatherings. Of course, this is going to be a huge underestimate of the true numbers of cases linked to these gatherings, because as you can see, amongst our active cases, many people have not said unknown category is the light green here. You can see that the majority of people are not telling us where they've been and what they've done, and so we don't have any idea what the source of infection is. In all likelihood, it's because many of these people don't really want to talk about the risk factors, and likely many of them may have attended gatherings, events, traveled, etc. And so this is an underestimate. But there are definite inequities that lead to greater transmission in the household and workplace in more cases. And that is why we're seeing 65% of our cases occurring in the Latinx population. These are the people who have been essential workers throughout. They have not had the luxury of staying at home because they're considered part of the essential workforce. And they may also face economic barriers for staying at home, sheltering in place, isolating, quarantining if there are cases or contacts. So now what I'm going to do is turn this over to Dania Candela to discuss inequity as a primary driver of cases in COVID-19.
Thank you, Dr. Shande. Dr. Mace, I'm sorry for passing that over. I think I'm used to saying that at this point. For passing it over. Yeah, so, and as you guys and the team knows, really in October 2020, we received from the Board of Supervisors really approval to engage a robust multi-pronged strategy to reduce the COVID-19 impact on our Latinx and Indigenous communities. Some of those things including expanding really intensive and data-driven testing through our pop-up testings in those disproportionate within the same communities and neighborhoods, really enhancing our outreach to the Latinx community, providing an incentive program and financial assistance, and partnering with our business community, where we know a lot of these populations also are part of, providing isolation and quarantine support, communication, and really in promotion through campaign, through a culturally responsive approach in both languages as well. Next slide, please. So one of the things that we really focused on was our enhanced outreach to the Latinx community through our collaboration with On the Move and providing COVID-19 urgent response through the CURA project. And through the outreach and really partnership with the family resource centers that CURA has created, CURA really serves our Indigenous communities and Latinx, really being able to reach a wide range of folks that are across our county. Bicultural and bilingual and bicultural services were at the forefront of this, and they did some amazing work around health education, really around COVID-19, how to keep people safe. Emergency financial assistance was one of the big components, and connection to food, legal aid, and also mental health needs as we were reaching. So that's one of the big strategies. CURA continues to serve families, and as Supervisor Hopkins mentioned, the board also approved additional funding for the CURA project to continue moving forward. Next slide. Here's a quick overview of CURA's impacts in really the 3 months through their, just between October and December. These do not include the numbers of moving forward, as they revamped services again starting in January. But we can see some key remarks here in terms of their outreach. Around 3,854 individuals were able to reach a total of 59 events. And I should mention that outreach really engaged cultural responsiveness in terms of being like markets, Lolas, and all of these places where we know our community members are. Financial assistance ended up totaling out $1,107,900 and was provided to 722 families. We also know that proportion of participants who were extremely familiar with COVID-19, and we found that they knew how to protect their health, increased from about 14% at the beginning of the program to 88% after. And the cultural appropriateness was a key component of all this, and 100% of the respondents who participated in CURA felt comfortable and respected, and also they knew they were served in their preferred language. Next slide. And I'll turn it over now to Dr. Mace or Dr. Shande.
It comes to me. Thank you,
Yeah,
Dan.
it comes to Dr. Shande. Dr. Shande is going to cover the rest of the slides and really delve into the vaccine implementation distribution process.
Good evening, everyone. Thank you for having us. So we all know how difficult this has all been since COVID came upon our community. It's been a very dark time, and there's hope. The vaccine is our way out of this situation. We just wish that the supply could come in faster than it has. So I'd like to go over some details about the vaccine to help everyone understand and see where we are and what our plans are. So as we know, there are 2 vaccines, the Pfizer and the Moderna vaccine, and they've both received FDA Emergency Use Authorization, or EUA. What EUA means is that it cannot be mandated. It can't be required of anybody, but anybody who gets a vaccine needs to fill out a standard consent form. But it's important to understand that nobody can be required to have the vaccine. That being said, we know that this vaccine is extremely effective. So the Pfizer and Moderna are both what are called mRNA vaccines. They both require 2 doses. The first one, Pfizer, requires 21 days in between the doses, and Moderna requires 28 days. And that's based on the studies that were done that showed maximal effectiveness at those intervals. The big challenge with both of them, well, actually with the Pfizer, is the storage requirements. -70 to -80 degrees is extremely cold, and it's very difficult to maintain that temperature. And that naturally creates a lot of difficulty in who can store it, how it can be stored, how much can be stored, and then how it can be transported out. The Pfizer, once it is thawed out, then it can stay in a refrigerator for 5 days, but it has to be used up within those 5 days. The effectiveness rate is 95% with Pfizer. With Moderna, the storage is not as difficult, it's -20. But the nice thing is once it's thawed out, it can stay in the refrigerator for up to 30 days. And it is just as effective as the Pfizer vaccine. I would like to mention, I know there's been concern about the Moderna vaccine because last week, I think it was exactly 8 days ago, there was the concern that there was a batch of the Moderna vaccine that had been given out in San Diego. There was concern about its safety because there were more adverse effects. However, that same lot was released throughout the country and throughout the state, and there were no adverse events, no significant increased amount of adverse events. So they're still investigating to see what happened in that particular clinic, but it seems to be related to that one site. So I want to stress to everybody that Moderna vaccine is just as safe as Pfizer. And in fact, in the beginning, there were a lot of concerns about emergency anaphylactic reactions, severe allergic reactions. We've heard about that in the UK. Here in the US, there were some, but it's really quite minimal. They've said that there's a reaction in one in about 2.5 million. So it's a very rare event. And given how many doses have been given out at this point, the safety profile seems to be quite good. Next slide, please. So it's a little confusing to understand what happens with the vaccine. So hopefully this slide will shed a little bit of light on it. So the vaccine is released by the federal government through the CDC, Centers for Disease Control. And the CDC then releases that vaccine to the state of California or to the chain pharmacies, Walgreens and CVS. The chain pharmacies have a federal pharmacy partnership program through which they go into the long-term care facilities, the skilled nursing facilities, as well as the residential care facilities. And they have been responsible for the majority of the vaccinations given to staff as well as to residents in those facilities. Our allotment, the state of California, allots between, it splits it up, not equally, but splits it up to the local health department and the multi-county entities, which means the Kaisers and the Sutters and the St. Joseph's, the healthcare groups that span many different counties. The multi-county entities then will distribute to their regional hospitals. So Kaiser, for example, their allocation is for most of the Northern Bay Area, and then Kaiser and Santa Rosa will get some allotment of that. So our department gets our allocation from the state, and then we allocate it out to our partners. So I want to stress that the county is not involved in administering. We don't actually give the vaccines, but we do work with partners who then create a program to establish to administer the vaccines. Thank you. So wanted to go over where we are in the tiers. You've all probably heard about the phases and the tiers. So we are still in phase 1A, but we are also moving into phase 1B. It's not a rigid process. We are kind of in between phase 1A and 1B. So in 1A, we have taken care of all the hospital folks, healthcare folks. The pharmacies, again, have taken care of the long-term care facilities. And we're still working on tier 2 and 3, which are basically federally qualified health centers, primary care offices, as well as specialists, dentists, chiropractors, many different therapists, so many different groups like that. In-home service workers are a big proportion of that group. So we are working hard to try and reach all of those people. We are slowly moving into phase 1B. As you know, that we are trying to target the older population, the over 75 population in particular. there's a lot of confusion about frontline essential workers. So within phase 1B, tier 1, there are only 3 essential worker categories that are covered, and that is education and childcare, food and ag, and emergency response or law enforcement. After we take care of that big group, which is huge, then we will go on to some of the other groups that are listed down below: the homeless, the unhoused, transportation, and critical manufacturing. But I want to stress that in the very top group, we are focusing on over 75 in Sonoma County because it's a sizable proportion of our elderly. The people over 65 comprise 102,000 out of our total population that's in the range of about 460,000. So it's significant. So it's going to take us a while to get through this. And as Dr. Mace mentioned, this is the population that has the highest mortality. So we need to address that issue. At the same time, we are moving into these other essential worker tiers. Again, the issue is the vaccine supply. So if we would be able to vaccinate everybody, we would, but we have to go in this tiered approach because we don't have the supply. So unclear how long it's going to take for us to get through phase 1B. After that is phase 1C, which is adults 50 to 64, adults 16 to 49 with some medical conditions or disability, other essential workers, water, waste management, IT, communications, government operations. After that is everybody else. Next slide, please. And I should mention also in the previous slide, the recommendations from the state are constantly changing. Every week we have revised recommendations on what to do. And the most current recommendation is still awaiting final clarification from the CDPH, California Department of Public Health. So it's a difficult process, a lot of moving parts, because it all depends again on vaccine supply and how the process is rolling out. So where are we now? So as of, what's today? Today is the 28th. So as of yesterday, there were 34,802 doses administered. You can see from this graph that we've been steadily marching upward. When we first started in the beginning of January, we were down here. There were only about 8,000 or so doses, and now we're all the way up in, I think today it was 36 or 37,000 doses administered. So we're making good progress. So residents with 1 dose, 21,348. Residents who've had 2 doses, 6,727. So fully vaccinated residents. So in general, with our, so far our population, 62% of those who are fully vaccinated are female, 38% male. And you can see the breakdown by age group. So the majority of those who have been vaccinated so far are in the 36 to 45 age group. And of course, there are fewer in the younger age group, but this is the one, the over 75 is the one that we are really working on because we haven't been able to reach as many of them at this point. This graph shows you the same thing, just in bar graph form. So fully vaccinated residents by race and ethnicity. So of those who've been fully vaccinated so far, 61% are non-Hispanic, and that's largely because the groups that we've targeted so far have been those who work in healthcare, many of the healthcare providers in the hospital especially. And as I mentioned, we are working through the primary care groups right now in the federally qualified health centers. Hispanics comprise 7%, and unknown population is 32% who decline to declare their ethnicity. So here you can see, okay. So there's just the breakdown. Next slide, please. So vaccine equity strategies. So we are trying to be transparent in what we're doing. We are trying to communicate with the community as to what our goals are. And we're really trying to prioritize those who are the most at risk. And as mentioned before, for us right now, that's our elderly population because they have the most mortality. At the same time, we want to provide culturally responsive practices throughout the implementation. Dania, I don't know if you'd like to jump in here.
Yeah, of course. No, I think you've covered the first points very well, Dr. Shande. In culturally responsive practices, we are working implementing an equity best practice approach in conjunction with the vaccine equity strategies to ensure that we are providing culturally responsive practices. And that really looks in the ways of what does equity look like when we're walking into a vaccine clinic, right? Like acknowledging that we have to have name tags that say, yo hablo español, things of that nature, and really understanding that our forms are absolutely bilingual as well. And we're diligently working around the clock to ensure that this is happening. And also acknowledging just the negative and painful history of their healthcare system has had in the communities of color. And that has really led to the distrust of research and government entities. So really engaging with community and stakeholders to really understand their concerns and respond to those needs as much as possible. And at the same time, doing our very, very best to communicate effectively in a culturally sensitive way through those trusted partners. That includes convening with our community health centers. We know that a large population who may be uninsured, undocumented, go there as a trusted place, but engaging with our family research centers as well and other organizations. And the big one is really learning and improving as we go through this entire process. So that's part of a little bit of an overview on how we plan to continue to push equity as a forefront through this vaccine rollout.
So, vaccine operations. So at this point, we have really rolled out a number of clinics that, again, are supported by the county, not clinics in which we actually administer the vaccine, but now we have the capacity to provide up to 2,500 vaccines a day for targeted groups. So far, these sites include the AMR and Fire Agency Clinic for first responders and law enforcement that's taking place at Public Health on Cien, Sonoma County Medical Association Clinic for healthcare providers in tiers 2 and 3 at Grace Pavilion, Safeway clinics for in-home support services workers at the Sonoma County Fairgrounds, the Clinical Health Appraisals Clinic for public health workers at the county property at the county administration. We have DEMA Consulting Clinic for promotoras at Roseland Library. They also will be working at the fairgrounds. The fitness center, so all of these places are where we actually have had vaccines administered so far. The fitness center at the JC Petaluma campus, that's going to be starting up soon within the next week, and that will be headed by the Petaluma Health Center. Huerta Gym in the town of Windsor is going to be specific for those ages 75 and up. We are working on a group that will be able to administer vaccines in that site. And as you all have probably heard, OptumServe in Rohnert Park is for those 75 and up. And in addition, we are, actually this just got finalized yesterday, we have finalized that a site in Sonoma Valley, the Sonoma Vets building, will be used. And there are 2 groups in town that will be providing vaccines at that site. So this slide helps to see where we began in the beginning of January and where we are now. There are a lot of numbers, but the most important numbers to look at are in the first week of January, we administered or helped administer 1,120 vaccines. The following week, we went up to 1,425. Week after that, 2,100. Week after that, 5,604. And next week, we plan to administer at least 8,275, and it's looking like it's going to be way more than that. So each week we've been building infrastructure and to make it possible to be able to administer the vaccine as efficiently and as quickly as we can. These numbers don't reflect our hospital partners. So Kaiser, Sutter, St. Joe's are administering vaccines on top of that. And this also doesn't account for the skilled nursing facilities or the residential care facilities. So this is simply what the county has the capacity for and what we've administered so far. And this graph over here shows the many different sites that have sprung up. So you can see in the first week, we only had basically 2 sites. We went to 3, now we've got all of these, and it's just going to continue. We actually had a wonderful meeting today with the federally qualified health centers. All of them are going to be working in concert and in collaboration to provide expanded access, not only to their patients, but particularly to the community at large, so that we can reach more people in the community who do not have healthcare and don't have access. We want to make it as easy for people as possible. And it's just been incredible to have so much engagement from the community in general, and to have all of these providers really work together to get this job done. There's also been a lot of interaction with the Kaiser, as well as with St. Joe's, as well as with Sutter. So it's going to be a real strong community effort, and it's exciting to have so much momentum and so much positive energy being put into this. And it's also been quite thoughtful. So I just wanted to mention one thing. Chairwoman Hopkins mentioned this earlier. The most recent site that we opened in Rohnert Park, we specifically targeted people over 75 who had disabilities, who don't have access to technology, who for the most part didn't have access to healthcare, and the Latinx population, because we realized that these are the groups who will not know how to click onto a link online and just make an appointment. And so we had a concerted effort earlier this week to reach out by phone to get these people signed up, and it was successful. Within 48 hours, we were able to reach out to more than 500 people over 75. And it's hard to control something like that. And as you may have heard, now that site is public, so it's open and available to others. But we will be doing the same kind of thoughtful planning at the site at the fairgrounds next week. So those dates haven't, or the appointments have not been released yet. And we are going to start outreaching the same way that we did earlier this week to try and reach this population, which we have estimated to be in the thousands. So we're really working hard. We're trying to be thoughtful. We're trying to be strategic. Nothing is perfect, but we are really doing our best to try and reach the most vulnerable, as well as those who are hard to reach within our community. And I think that's it for our slides. I'm sure that you all have questions. So we'd be happy to answer them for you.
And thank you very much, Director Robinson, Dr. Mays, Dr. Shende, and Ms. Candela, for providing us that information. You guys have been tasked with a monumental thing to overcome, and you're exceptional leaders. So we appreciate all the effort and hard work that you've been putting into this. There are a lot of questions trickling in, but I want to give time to our Director Shiva Person Whitley to talk about the economic impacts that we've had under this pandemic and what she sees going forward for the county.
Thank you so much. So good to be with you all. Thank you for having me. In the interest of time, so that we can get to those great questions, I will be brief. I'm not going to be sharing a PowerPoint, but just giving an overview of what the Economic Development Board has been doing in the response to COVID-19 and our look ahead in 2021 as we look towards recovery. So certainly our vision and priorities for 2021 are going to be to continue to support our small business community as they continue to grapple with the impacts of COVID-19. For us, that really means providing a tremendous amount of resources and technical assistance that happens in a variety of ways. We've done a series of webinars where we bring business leaders, industry leaders, experts. Dr. Mace has helped us out with some of those as well, to make sure that we are able to provide relevant, timely information to the business community. Some of those webinars have been on subjects such as how do you access PPP? How do you access the new round of state grant funding that has become available at the state level? Things such as e-commerce, and as we've seen, since last year, so many businesses have needed to change the way they do their business delivery. They weren't able to do that in person, and so they needed to look at, how do I do that online? What does e-commerce look like? How do I optimize social media and marketing platforms to drive new traffic to a website to engage in e-commerce? And just understanding the health orders. So that's been a huge undertaking. We've had over 1,000 businesses participate in those webinars since April of last year. We will continue to do those virtually for now until we are in a position as a community to safely gather later on. We anticipate later on this year. So we will continue doing that. We have a set of best management practices and plans that we had industry leaders and our partners at Health come together to think about, how do you mitigate? If you want to mitigate against the spread of COVID-19, for a small business, that can be quite intimidating. So we have 18 of those that have been developed. They have changed and tweaked a little bit over time as the health orders have changed, as well as guidance from the governor's office. You've heard our other panelists talk about how things rapidly change out of the governor's office. And when you think you have a solid roadmap, they come out with something new, and they don't always give us advance notice. We know that that creates a lot of challenges for our local small businesses. They really need runway and time in order to be able to adapt and adjust, to prepare for those changes. But unfortunately, they don't always give us advance notice, but we certainly do whatever we can to communicate that information as soon as we see it. There's been a number of resource guides specifically related to disaster, COVID, emergency, all of those different things that the small business community has been struggling with, and making sure that we have resources available that they can access. They'll know what is available to them. It can be, again, overwhelming and quite intimidating for them to try to tackle that on top of everything else when they're just trying to survive. They're just trying to not permanently close. And everything that EDB has been doing around our webinars and our resource guides, if EDB produces it, thanks to a partnership that we now have with Watson Lab and Ricardo, we're able to do interpretation and translation for that. So that's been a really, really impactful thing that we've been able to do to the Latinx community and monolingual small business owners in particular. We do have a business diversity program. We will continue to lean in on that because we know that equity is very, very important. So language access falls into that, as well as making sure that what we are doing is culturally sensitive, responsive, and relevant. We want to, really be very thoughtful, talk to our partners about, the resources and the things that we're producing as a department, and be sensitive to those things, and make sure that it is truly relevant and not just bare bones translation, but if there's something else that we should be doing, going above and beyond that, we definitely want to be a leader in that. Around equity, we have actually added an equity lens to our programs. So for us, that really means focusing on historically underserved and disadvantaged populations. That includes communities of color, people of color, and low income. Socioeconomic is very, very important. I think when you think about the United States and where disparity happens and those disparate outcomes, you can't really decouple race, ethnicity, and class. Those things really go hand in hand. There's so much data from decades and decades of studies that really demonstrate that in a quantitative way. So for us, it really means focusing on low to moderate income, as well as people of color, BIPOC communities. We did that with the Small Business Grant Program. So back in December, we had $2.5 million in grant funding, thanks to Chair Hopkins and the rest of the Board of Supervisors. We were able to serve 542 businesses. Of that, 48% were people of color and 80% were low to moderate income. So that's the result that you get when you're really intentional about equity and making sure that the resources are available to the people who need it most, and the people who, through oftentimes public policy decisions, have been excluded from accessing programs. And we want to do whatever we can at EDB to really lean in and make a difference. We'll continue to do business assistance. It's really interesting that even though we're in a pandemic, we still have people calling, entrepreneurs calling our office, setting up virtual appointments to talk about how do you start a business and what does that look like? So we're continuing to do a lot of that work. I did mention a business diversity program. Marco Suarez, who I'm sure everyone on this call is very familiar with and has a long history with, he's the program manager. We do a lot of partnering to help Marcos build capacity, because he is only one soldier, right? One soldier out there trying to do this work. And we really know that in order to really serve the Latinx population, and as well as other, businesses of color, people of color, we need partnership in order to help us build capacity. So we're really excited to continue to do that. I would be remiss if I did not mention the digital divide. We know that that's an ongoing issue, and it's been a long-standing issue, but certainly, like lots of other things, COVID exacerbated the challenges that we already had around access. There's certain parts of the county that just don't have connectivity. Sometimes finances can certainly be a barrier to entry if people want to be able to, you know, have internet at their home. It's a real challenge. And so what we've seen with COVID is when people want to help their kids be able to do distance learning, that's a huge impact when they can't do that. Or if people are out of work and they want to apply for a job or they want to continue their education as an adult, all those different things are tied to connectivity. So when we did our grant, although everything we did was online, we set up 5 resource centers throughout the county to make sure they were geographically dispersed. We had them available by appointment. So people who had access challenges, whether that be language or connectivity, were able to set up appointments, go in, use the equipment, use computer, use scanners, get technical assistance that they really needed so that they would have an opportunity to actually apply for that grant program. And as we move throughout the year, certainly we're going to be leaning in hard on recovery and what that really looks like. We do have a recovery action plan. We had over 500 community stakeholders participate virtually with us to help us think about long-term, short-term, and mid-term recovery. There's a real focus on business recovery, community recovery, and workforce recovery. And we have a number of actions that have been identified by those stakeholders. We've already started some of those. I'm really excited to say we're not waiting. We know that we can't wait. There's a sense of urgency, and so we'll continue with implementation of that. We are going to be doing a workforce development program and mentorship in our department. So very excited about the opportunity to help support our displaced workers. There are so many in the county who have been displaced because of COVID-19, particularly around retail, leisure, hospitality, tourism. They've been the hardest hit industry sectors. There's so many people out of work. And so we're excited to be able to kick off that program in the next couple of months and really connect the Economic Development Board with JobLink, as well as local employers who have opportunities to get people retrained, reskilled, and really on a new career pathway. So very excited about that. I feel like it's really timely and relevant. It's something that we really, really need. And I would be remiss if I didn't, mention that, of course, vaccine rollout is at the top of mind for everyone. So, of course, EDB, or Economic Development, we don't necessarily have a direct role in that, but we are partnering with Director Robinson and Health to distribute information to the business community so that they know what the resources are, so that they know what categories fall in essential, what phase does that fall in, and then what tier does that fall in, and what would that projected timeline look like. There's so many questions that small businesses have about the vaccination program and the rollout. So we will continue to partner with Director Robinson and others to make sure that we're able to bring that information out and elevate it as well. So that's just a high level overview. We've been really busy. I'm super excited. I mean, we have one of the tiniest little departments right now. We have 14 full-time people to serve this beautiful county. And so we work really hard. And of course, we always want to partner. If there anyone who's on this Zoom today who needs assistance with their business, please do not hesitate to reach out. If there's anyone who would like to take some sort of role in the recovery work that we're doing, please reach out. I'm all about partnership and collaboration, and recognize that at EDB, there is no way that we can get all this work done on our own. It really takes a community effort. And I just have to say, I'm so proud to be a part of the work. Thank you.
Well, thank you. Thank you so much, Director, for giving us that great overview. I know that the Economic Development Board had a seminar today early in the morning, and you were part of it. Supervisor Hopkins was part of that effort, and it's been a long day for you and for everyone here on this panel. So again, a big kudos from Cien to all of you for all the hard work that you do. What I want to do next is hopefully I can keep you for a few minutes and ask you some questions in a sort of round robin style, and see if we can get your best succinct responses, so I can get as many questions out there, because they've been coming in endlessly here. And I'm going to go. I'll go into the government question first. One of them is, I guess this would be for Supervisor Hopkins here. You mentioned earlier on, Supervisor, that there was an infusion of cash that the county received, 14.7 million, I believe, for emergency rental assistance. And you've also highlighted a couple of other efforts like tenant protection, expanded sick leave pay, and additional resources for vaccination. These are all efforts that the county wants to promote, but these efforts also take resources. So how do you see the sort of the financial picture in a snapshot in terms of getting those things done, and how do we do that?
So we have actually already identified the source of funds and have committed the resources. Luckily, with the emergency rental assistance, those funds came from the federal government. And the biggest thing right now is we are crossing our fingers to hope that we get more money from the federal government, because I will be honest, our reserves are running thin. And if we were to have another fire or another flood disaster, we would be hard pressed to have the funds to respond. So we're digging into some pots of money that we had set aside previously for infrastructure, the infrastructure sinking fund, and we're trying to use that to protect our most vulnerable community members, because we just want to get folks through the pandemic and try to get them out the other side stronger.
Yeah, thank you so much, and for that honesty as well, because there is going to at some point be some limitations on funding, but I know that you're trying your best to get as much as you can for all these efforts that you want to implement. So thank you. The next question is for the healthcare group. There's been several questions on vaccinations, but one of them, the one that keeps on coming in different permutations, has to do with how do we ensure that all these other health partners who are rolling out the vaccine are also taking the same kind of principled stance on equity distribution as the county is. So anyone from Director Robinson, Dr. Mace, Dr. Shende, Ms. Candela.
I'll jump in because I think that I might be able to speak a little more freely about this, and please, okay, feel free to add. But I'll be honest, the way that the framework has been set up is not equitable. And I am very concerned that folks who, I've heard of people with county hopping with Kaiser, right? They can't get it in Sonoma County, so they're going to drive to another county, or people who are staying on the phone for 6 hours, right, just to get an appointment. And not everyone has that luxury. So I'm just going to be blunt, is that I am very concerned about equity, and I am not sure that it is being implemented. And I feel like I might have an ability to speak a little more freely, and critique honestly. So we call them partners and we do want to work with them, but there needs to be accountability as well. And the way that the state has set up the system, the way that our healthcare providers have set up the system, it's very challenging. And I feel like people who have, good relationships with a primary care provider, who have good insurance plans, they are ahead of folks, say, are undocumented farm workers or people who don't have that level of access. So I am concerned about it. And I, would open the door to the folks who work more closely with the healthcare providers to share a little more.
I think that's absolutely true. Sorry.
Oh, I was going to say, Dr. Shende, I didn't know if you wanted to. Go ahead. Go for it.
Okay. Yeah, I agree with you. There are a lot of challenges to vaccine implementation in an equitable way. There's no question about that. Because of that, we are really, as I mentioned before, trying to have a strategic approach. And we recognize that it's going to continue to evolve to achieve even more equity as time goes on. But just as an example, for tiers 2 and 3, we did extensive reach out to people who are in the IHSS, the in-home support services categories, and the promotoras. We made sure that we have had specific clinics that were set aside for these groups, exactly because of what Supervisor Hopkins said, that it's hard to access for many people. So we're going to continue to do that. In each of these tiers, we're going to continue to try and provide opportunities that are somewhat controlled, as controlled as we can do, so that we can try and reach a good proportion of these groups. It's not going to be perfect, but the best we can do is to keep everything in mind and to keep moving forward with those goals in mind.
Excellent.
And again, the big issue is just the vaccine supply. So we have to be very, very careful in how we allocate it.
And a follow-up question to the vaccination supply is the issue that you're seeing having to do with the distribution or the final sort of last mile, as the economists call the last mile implementation of the vaccination?
It's just the numbers. There just isn't enough vaccine to reach everybody. I mean, for example, if we had enough supply, then we could possibly be all the way through phase 1, 1B tier 1 at this point, but it's not. That's not the case. Initially, I think that was the issue, that there was a bit of a slow rollout, but in the last couple of weeks, as you saw from that one graph I showed, the number of sites has increased tremendously, and over the next week to two, it's going to increase very rapidly. And thankfully, a lot of these opportunities to receive vaccine are going to be geographically scattered throughout Sonoma County. And it's going to be the partnership with the federally qualified health centers is going to really help us to get it to all reaches of the county.
Excellent.
Yeah,
So-
I just wanted to add, to that, Mr. Pardo, that, with Denya's, presence and leadership, we're able to call that question to our partners, right? What is your equity strategy? How are you putting that into place so that we can make sure that there is access for those that are most vulnerable and underserved populations that historically have been denied access to the resources, the healthcare resources that are necessary. So you're absolutely spot on in terms of that question. And that's the question that the county and the health department is calling on our partners to demonstrate their equity strategy. And we're here to support and provide that technical assistance and guidance. And Ms. Candela is doing a great job in helping us do that.
Thank you all. Thank you for those responses. I'm moving on to an economic question that we received in relation to small businesses and sort of big box stores that have not closed down during the pandemic in any phase of it. And so the question was more directed generally in terms of what other efforts are being done for small businesses specifically to kind of help them through until they get to their startup phase again. I know you mentioned that there were some CARE grants that were being issued out.
Yeah, absolutely. So we've had a series of grants. We've been providing technical assistance again because for a lot of businesses, they really needed to move into online sales and e-commerce. And some of them, number one, had never had any intention of doing that and didn't have the technical experience or expertise to be able to do it successfully. So we've brought to bear a number of webinars, conference calls, one-on-one, help with people. Marcos has gone out into the community to social distance and meet with people outdoors to say, okay, here's some resources if they have challenges around access or anything like that, actually handing out information. I do think we have to acknowledge that for various reasons, unfortunately, not every business is able to adapt and do online sales. It just doesn't make sense for their business model or the types of service that they deliver, right? So that's been a huge challenge. And I do think, in addition to that, there's been a lot of adaptation. We saw that really, really early on. For example, clothing manufacturers making masks, right? We saw a number of chemical companies and distilleries making hand sanitizer and other cleaning products that they historically never would have made, but because of the demands and the climate and change around COVID-19, they try to adapt and do whatever they can. So that's a lot of what we've been doing. I do know that it's a very tough time. It's a struggle. This new round of PPP is actually very helpful. In addition, the state has almost $1 billion worth of grants available for small businesses. And so we've been shepherding people through that process, trying to get the word out as much as we can to make sure people are even aware. And if they have challenges, we've had a number of webinars specific about how to access it. If you need technical assistance, we have a number of partners, lawyers, for example, that have been offering their services for free, saying, hey, if you have any issues, some technical challenges, we can help you through that, making sure people know that even if they receive the first round of PPP, they can go after this round again, right? There's some confusion out there. So we try to do whatever we can to make sure that people are aware of what resources are available and to help shepherd them through those processes. But it's certainly, it's a very challenging time for our small business community.
Thank you so much. I got a couple more questions, and I know it's been a long night, so we may have to let you guys go. But one question that's kind of a morph of a few, vaccination type questions have to do with, and I'll say it in a couple of parts here. First is, if there is a known percentage, a high percentage of individuals in the Latinx community who are being infected. Is there any way to target that population, or is the efforts constricted by CDC guidelines? Part one. And part two, if there are sectors that have, agricultural, retail, or so forth, that have a high infection rate, is there a way to target those sectors as well as part of the first wave of vaccinations, or is it still constricted by CDC guidelines?
I can speak to that a little bit, and then Dr. Shende can let me know if I might have missed anything. But the standard right across the board is that the state does kind of give us their guidelines. So where we're ensuring and embedding equity through this different tier system is acknowledging that we may not have control necessarily over what the state criteria is, but to achieve equity, we can identify what the criteria within the phases to help us address those populations who have the greatest risk and who have been disproportionately affected and impacted by the disease. So we're looking at things like incorporating the healthy index place, where people live, work, play, geographic location, race, and all those components, socioeconomic status. So that anything that I can add, Dr. Shande?
No, that's exactly right. And with recognition that we're now moving into phase 1B, tier 1, which will include a number of people from different backgrounds. So it's not just going to be healthcare anymore. It's food and ag, it's childcare, and it's continuing to be people who care for others. And so we're going to start reaching into different sectors of the population now. And as Denya said, also trying to strategically look at geographically where people are, the HPI, and take that into consideration. So within those priorities and those tiers, there's a little bit of wiggle room, but we also have to make sure that the major objectives are achieved. It's a delicate dance. It's challenging. It's not easy.
What would be, as a follow-up to you, Dr. Shende, what would be the sort of ideal number of doses that you would like to see being administered on a daily basis in order for us to make progression in a faster rate?
Oh, if I had a magic wand?
If you had a magic wand.
Yeah, if I had 100,000, then we'd be done with this very quickly. But there isn't such a number. I mean, right now, of course, it depends on how many sites are set up and how soon we get it from the state. You know, it's not just a matter of what we have, but it's also every week we get allocated a certain amount. So it's just kind of trickling in. I think we'll be in good shape if we are able to double or triple the volume that's coming in right now. And time will just tell if we're able to do that. But
I would like to just add that Dr. Shende and Ms. Candela and Ken Tassif, our mission manager on the vaccine side, have done tremendous work to scale up our capacity from a logistical standpoint to have mass vaccination sites throughout the county and stand them up rather quickly in the event that we hope and pray we get those doses in so that we can respond quickly. So I think it's important for the community to know that we do have the capacity to coordinate all of the components of administering the vaccine. It's just a matter of getting the doses. And I think you've heard us say that quite a bit tonight. And I think that's the message, right? Supervisor Hopkins has said, we need a supply and be patient. And I know that Dr. Shende's echoed that, this tonight as well.
Excellent. Yes, and thank you for reminding us that, because we do need to be patient. And a lot of the questions that we've been having are coming on the vaccine related side, and having to ask, how do we create any safeguards or limitations or screens to ensure that the people that go first, and people aren't jumping in line. So I know you've given us a lot of ways that is happening, but so what I'd like to do now, because I know it's getting late, is kind of, we started off this program talking about what do you see in 2021, and where are we trying to get to, and what vision do you have? So I'm going to divide it again into the 3 panel sections that we had, go back to Supervisor Hopkins for her final thoughts, and then move on to the public health, and then move on to the economy side. So what do you see?
You know, I do feel like I can see the light at the end of the tunnel. But I think that what needs to happen most is our community needs to pull together. And that actually means that some people like me say, you know what, it's not my turn yet. I don't deserve a vaccine right now. The people who deserve a vaccine right now are those frontline workers, right, who have the highest rate of exposure. And we need to protect those people who are most likely to get the disease and also the most likely to transmit the disease. So sometimes, you know, asking baby boomers who might be wealthy retirees who have the capacity to shelter in place, you know, and especially since we now have the 65 and up and the 75 and up, there's, you know, blurry lines at the state level. If you are low risk, if you have an opportunity to shelter in place, consider letting, you know, waiting, right? So that's kind of what I meant when I said, if you can get the vaccine, doesn't mean that you should get the vaccine right away. And part of that is that there've been links flying around, right? So you can technically click on the link to make an appointment, but it's not yet your turn. So I think that we need to come together as a community, and as a community, not just talk about equity. I think we do that a lot in Sonoma County. We actually have to practice equity. We actually have to live equity, which means that someone like me who's privileged to be able to work virtually, right, to speak through Zoom all day, that means that I don't need a vaccine right now, that I can wait my turn. And I also, you know, think that's really important, particularly for some of our members of the community who might not be able to vote, who might not feel comfortable lifting their voices up, and also for our children, because we need to vaccinate our educators so that kids can get back in school too. So, you know, just try to live equity and not just talk about it would be my request. And I think if we do that, we're really going to show that we're Sonoma strong. Not only can we get through fires, not only can we get through floods, but we can get through a pandemic sort of being separate together, right?
You're here. Next.
Yeah, I'll just say that through adversity is opportunity. And what has been laid plain and amplified is the disparities. And in that is the opportunity for us, as Supervisor Hopkins has said, to live our principles, to live our values, and to have that reckoning, the racial reckoning, you know, that we need to have in our community to address these kinds of disparities and the institutional racism that perpetuates these outcomes. And I think, you know, we're headed in the right direction to do that work. And my department is absolutely committed to it 100% to advance, you know, equity in all that we do.
Thank you.
So I will just close by saying I echo everything that my fellow panelists have said about equity is so important, particularly racial equity is critically important to our community. EDB is going to do our part to continue to elevate and lean in on those things. And in addition to that, you know, really it's important that businesses have access to information. That is one of the single best things that we can do because they need time to prepare. And, you know, providing them relevant, accurate information that they can count on in a timely manner is critically important. And I look forward to just helping our small businesses as they recover and move into recovery from the economic impacts of COVID-19 and the recession.
Thank you all very much for your time. It has been my pleasure and an honor really to moderate this panel of such exceptional leaders. Supervisor Hopkins, Director Robinson, Dr. Mace, Dr. Shende, Ms. Candela, Director Person Whitley. It's been an honor for me to kind of hear all your thoughts and views of where Sonoma County needs to go and be in 2021. I appreciate all your time. I appreciate all your effort. Cien appreciates all your time and effort because every time we've called you, you've always come. And so thank you so much. We leave you with a call to action as we always do, which in this instance is, please wait your turn. That's it. Let's all be fair. Let's all try to do our part to get us over this hump. We're almost there. I think I agree with Supervisor Hopkins. There's a little light that I'm starting to see there, and we all want to rush to it, but let's make sure we get there safely. So with that, I thank you all. Have a good night, and we'll see you at our next program.
Thank you.
Thank you so much.
Thank you.